Physiotherapy is a treatment which, on the face of it, makes a lot of sense for people who have dystonia. So one way of thinking about dystonia is that it's a problem with the way that movement is being controlled, almost an abnormal learned pattern of movement that's got set up in the brain. And if you think about it like that, then it might be possible to somehow unlearn that pattern, or at least change it in some way. And physical treatment would seem like a sensible way to try and do that. Having said that, exactly what kind of physical treatment would be most useful is something which is still a subject of a lot of debate and probably needs quite a lot more evidence to be gathered about the best way to treat it. I think that in general, a physiotherapy assessment and treatment can be useful for most people with dystonia, because as it's quite a chronic condition, so it's there for a long time, people tend to develop strategies to try and help compensate for the abnormal movement. So they might adjust the posture of their back, or they might stand or walk differently. And sometimes those compensation strategies can make the problem worse, or they can produce stresses and strains elsewhere in the body. And so for that reason, using a physiotherapy assessment and treatment can be useful to identify those problems and also to try and change them. For the actual movement problem itself, there are some examples of physiotherapy treatments that can be helpful, particularly, for example, for neck dystonia, so trying to learn how to turn on muscles which are underactive, to turn off muscles which are overactive, and also to correct, as I was saying, these secondary postural adjustments that develop. For some people with generalized dystonia, again, one can use physiotherapy techniques to try and protect the body from any damage from secondary changes, given the way that movements are pulling the body into an abnormal posture. And sometimes, although not often, the use of aids such as splinting can be helpful for people with generalized dystonia. Having said that, sometimes if you put a splint onto a limb which is pulling from dystonia, the muscle activity doesn't turn off, and sometimes it even gets a little bit worse. So one has to be careful about that and work with a physiotherapist who understands dystonia. In the setting of task-specific dystonia, so this is where skilled movement has been corrupted or by dystonia, then there may be a role for specific rehabilitation there. So for example, in some professional musicians or professional sports players who develop abnormal posture during that movement, a certain type of retraining, often using a physiotherapist or sometimes a hand or occupational therapist, that is something that can help some people. One of the ideas behind physiotherapy treatment is that it should be something which is usually time limited. So the idea is to have an assessment, have some treatment to learn strategies about how, as far as possible, to control the abnormal movement, and then to have something which the person themselves can then take away and to do themselves. That's different from anticipating that one would need to see a physiotherapist regularly forever. I think it's usually a better idea to think about a block of treatment trying to get to a particular goal, and then to try and maintain that oneself through practice at home, maybe with top-up sessions from the physiotherapist from time to time. Probably the best candidates for trying physiotherapy are for people who have task-specific dystonia, and also for people who've got cervical dystonia or neck dystonia, because it's in those areas that evidence from physiotherapy is best developed. I think the other group of people who can benefit is really anybody with dystonia who is experiencing significant muscular pain. That often comes because people have developed compensatory strategies to try and deal with the abnormal movement, so they're putting stresses and strains on other parts of the body. And in that such situation, getting advice from a physiotherapist can be a useful way to help with pain. For some people with persistent muscular pain, allied treatments to physiotherapy, more around therapeutic massage, even complementary therapies such as acupuncture and so on can be a useful part of treatment for muscular pain. There are many different subspecialties within physiotherapy, and it's a good idea that if you're a person with dystonia looking for a physiotherapist, that you try and find somebody who first of all is a neurophysiotherapist, but also has experience of seeing people with dystonia and understands about the particular problems that people with dystonia have. Physiotherapy for dystonia makes quite a lot of sense if we think about what we think may have gone wrong in the brain. So one idea behind what goes wrong in dystonia is that there is abnormal plasticity, so there's abnormal learning in a way in the brain, so that an abnormal learned pattern of movement gets set up in the brain and becomes very stuck. Plasticity is a process in the brain which is very important because it's how we learn how to do anything. It's the way the brain changes in response to stimulation. And so it makes sense that if that process has gone wrong in dystonia, maybe the brain's learned and got stuck in a particular pattern, maybe you could unlearn it using physical treatment. And that's where the sort of rationale for physiotherapy comes in as a treatment for dystonia.